Welcome to the Unpacking the Framework video series. This series provides valuable information about the National Best Practice Framework for Early Childhood Intervention. My name is Denise Luscombe, and this video introduction is being recorded on Whadjuk Noongar Boodja. I acknowledge the traditional custodians of this land and the land you're listening from, and recognise their continued connection to country, waterways and community. I would also like to pay my respects to their elders, past and present. This video is one of a series that describes the evidence and practice information that underpins the principles of the National Best Practice Framework for Early Childhood Intervention. You will hear from both national and international speakers throughout this video series. This video covers evidence-informed, a key principle of the National Best Practice Framework for Early Childhood Intervention, and is presented by our national speaker, Professor Rebekah Grace. Rebekah is the Director of the Western Sydney University Centre for Transforming Early Education and Child Health, or TeEACH. Her research is focused on the service and support needs of vulnerable or disadvantaged children and their families, including children in the out-of-home care sector, children with disability, children who experience educational disadvantage, and children in high poverty contexts. She employs a cross-disciplinary, mixed methods approach to research and seeks to move beyond the bounds of disciplinary silos to address complex challenges. Her expertise is in applied research and in the translation of that research so that it's meaningful within practice settings and transformative to policy and practice. Rebekah has a particular expertise in the conduct of rigorous effectiveness trials within human service settings. Rebekah is also internationally known for her expertise in research using participatory methods with children and young people, and for her work in the community co-design of support services.
Hello everybody. The evidence-informed principle is an important one because it's all about knowledge sharing, it's about challenging our own preconceived ideas, and it's ensuring that our practice is of the highest possible quality. It's about drawing on all the information we have available to us so we can help children and their families achieve their goals. Being evidence-informed is vital to good practice, and yet, when I talk to practitioners across different sectors, there is occasionally a lack of enthusiasm around engaging with this particular principle. I suspect that these feelings are born out of experiences in which researchers and practitioners have positioned themselves as sitting in different camps with different objectives, values, and priorities. Contemporary conceptualizations of good research and evaluation do not allow for different camps. They start with the premise that researchers and practitioners must come together, bringing different skill sets, but with a shared mission to provide high-quality support that will lead to positive outcomes. This is why the language has changed, and we talk more about evidence-informed decision-making than evidence-based decision-making. The term evidence-based practice is still used, and it's fine to use, but originally it was used to describe a way of doing research that is now quite outdated. It's from a time not so long ago when we argued that research evidence should sit at the heart of all practice decision-making in order to ensure effective and high-quality practice and achieve the best possible outcomes. Evidence-informed practice sees research evidence as one critical component of high-quality practice decision-making, with practitioner wisdom and experience and client voice and context all playing an equally critical role. Evidence-based practice is research-centred, whereas evidence-informed practice is client-centred. Research evidence remains very important and it should not be disregarded or pushed to the side. However, in an evidence-informed approach, it is not the only knowledge that is important. So I thought I'd provide an analogy to demonstrate this point. Let's imagine that there is a group of children standing on one side of a raging river and we need to get them to the other side. We have a clear goal, which is their safe arrival on the other side of the river, but we're not sure about the best and safest way to achieve this. Initially, we try an entirely research-driven approach. So we call in the research team and we send them off to find out all that they can find out about how others have effectively transported children across rivers. They investigate barge design, bridge options, chartering a helicopter, and teaching the children advanced swimming skills. They weigh the evidence, looking at what has worked best for others with similar goals, and they return to the group. They let the group know that the approach with the best reported outcomes, with the lowest rates of child injury, are from studies of bridges, and recommend the building of a bridge as the best possible way forward. Now, this is fantastic. It's definitely the way to go. The children will remain safe and dry, and all of the children, regardless of their physical or cognitive abilities, can be helped to cross over the bridge. Brilliant. Assuming, of course, that building equipment and tools are all easily available, that there are people who have good engineering skills and know how to build bridges, and that the children have adequate food and shelter to remain healthy while the bridge is being built, because this is going to take some time. It turns out that in this imagined scenario, there is no adequate equipment or knowledge of bridge building amongst the staff. Some of the practitioners in the group feel really cross that so much time has been wasted waiting for the researchers to come back with an unhelpful recommendation that they can't possibly implement. So that was a research-centred approach. Now let's look at that scenario again with an evidence-informed approach. So this time, before the researchers head off to investigate what has worked best for others, there are group discussions in which the practitioners share their ideas and experiences in dealing with challenges of this nature. They have had some positive experiences with rope swings under these circumstances. They were worried that this strategy wouldn't work in this case because it would exclude those children who were not physically able to swing and jump off the rope on the other side. The staff were, of course, very keen to ensure that whatever strategy they employed, all of the children would be safe. The children were also consulted about their ideas, safety and well-being needs. There was a full appraisal of the resources that were available. So now the researchers head off with all of this in mind to find out what have been the most effective strategies for others in similar circumstances. They weigh all of the available evidence in light of their specific context, and they recommend now the building of a barge to transport the children. The researchers are able to gather instructions on how to build the best possible barge with the resources they have available to them. The practitioners have never built a barge before, but they do feel that the skills that are needed are within their reach, especially because they can learn from what others have accomplished before them. The practitioners are also able to bring their own ideas and experience to enhance the design of the barge. They set to work. The children also keep busy, collecting wood for the barge and learning to tie secure knots. The approach is effective. They ride across the river, and it may have been bumpier and wetter than if they had had all the resources that they needed to build a bridge. However, it was the most effective approach for this group because it was the most appropriate to their context. I hope that my example illustrates well just how essential it is for research evidence to be balanced with practitioner experience, the resources available, child and family perspectives, and understanding of the broader context. Good practice and positive outcomes rely on researchers, practitioners, children and families working together as a team. What all of this means is that research evidence to guide practice decision making is a constantly changing and shared journey as we co-construct knowledge based on what is meaningful in context. There is much to consider when making practice decisions. We know that context is important and that whatever we put in place must happen in partnership with all of the stakeholders, including children and families. This means that it is no longer possible to subscribe to an off-the-shelf way of thinking about evidence-based programs. We can no longer simply pick the program with the strongest evidence, drop it into our services or practices, and expect that it will work in just the same way that it did in a clinical trial. If we took that approach, then we would have to have stuck with the bridge in the first example, because that was the solution with the strongest evidence. I want to be clear in saying that this does not mean that we throw evidence-based programs away. It would be so foolish to disregard what has worked well in other settings. What it does mean, though, is that programs need to be carefully considered in terms of fit for local need and context. We need to understand who the programs have been most effective for and what adaptations would need to be made to be appropriate for our local context. Evidence-based programs and practices form an excellent starting point for good practice. But there is almost always work to do in understanding their core components and how they could be implemented in diverse contexts. You may have heard of a fairly new field of research called implementation science. Implementation science is all about how to achieve meaningful evidence-informed practice. There are lots of tools and frameworks that are used in this work. Here is just one framework that I find really helpful when I'm thinking about evidence-informed decision-making. I think this framework is great at capturing all of the issues that need to be thought through in service decision-making. This framework says that when you are thinking about putting a program or a strategy in place, you need to think through 7 different elements. You need to think about the specific needs of the people you are working with. You need to think about what research evidence says about what works best in other contexts. You need to consider how the approach you are considering will fit with your community and organisational priorities and cultures. It's important to think about whether you have the functional support needed for the approach. And you need to look at whether the staff have the appropriate qualifications to be able to deliver the approach and collect information on whether or not the approach was effective. Organisations also need to look at whether they have the resources available to support the approach. And they need to look at whether they have the necessary collaborative networks and buy-in from other service providers that's needed to ensure that the approach is successful. Let's use this framework to talk through a made-up example. Let's imagine that we're working in a rural community with high levels of socioeconomic disadvantage and lots of fly-in, fly-out workers from the local mines. We're concerned that many children are starting school without some of the basic skills and knowledge that is generally expected of children when they start school. For example, many children are starting kindergarten without being able to count to 10 or without any knowledge of the alphabet. Many of the children haven't had experiences with reading storybooks or using pencils. There are also some children who are struggling with basic skills like toileting. The local AEDC data, combined with the observations of teachers, confirms our concern for young children and the need to support their preparation and transition to formal education. We know from research that early education experiences can set a child on a trajectory for their learning futures, and so we know that this is an important investment to make. So we start by looking to understand the need. We examine the available data and we talk to local community members, teachers and parents about their perceptions of the challenges and what they think might be needed to better prepare young children for school. It becomes clear to us during this phase that the children who are struggling most are those who are the children of the miners. We learned that these children move with their families frequently, and as a result, they generally have not attended early childhood education services or spent a lot of time with other children their age. So we decide that we're going to prioritise working with these children as a first step. Next, we review the evidence. So researchers and practitioners work together to review which are the transition to school programs that have the strongest evidence base. We search for transition to school programs that are home-based for children who don't attend early childhood settings, and we look to see whether any have been tested with rural and transient populations. We learn a lot in this review about the best ways to support children and families and the most important skills for children to develop before they go to school. And we end up deciding together that the HIPPY program is an evidence-based program that we would like to implement in our context. HIPPY seems to be a really good fit in terms of community values. However, we are worried about whether we can implement it properly because HIPPY is generally delivered over 2 years. And we know that many of our parents are not in our community for a full 2 years before their child starts school. So we decide we'd like to adapt the program so it can be delivered over a shorter period of time. We would also like to incorporate into the program some of our learnings from the research that we've reviewed, directly addressing issues of transience and the impact on child development. We want to feel confident that our adaptations will not compromise program effectiveness, and so we work with researchers in our adaptation and decide to conduct a pilot study. Then we embed ongoing program evaluation in our delivery. The usability of the program seems to be clear, and we quickly are across the elements of the program. We feel confident that it can be delivered within our community, although we do have some concerns about our current capacity to implement because we do not have any workers who are trained as HIPPY facilitators. We examine our resource availability to ensure that we can afford the program, afford to send our staff to training and support the ongoing costs of the program. In all of this work, we have partnered with the local primary school to ensure that we're addressing their goals for the children and also to incorporate into our program early engagement with the school. We've also partnered with the mining company who have agreed to provide some funding to support the rollout of the program and to support the participation of their workers by offering flexible work environments so they can attend HIPPY sessions. A partnership has also been established with researchers to ensure rigorous evaluation, review of the literature and dissemination of our findings so we can support other towns with similar challenges. We have formed a strong consortium and capacity to collaborate. Evidence really is a critical component that cannot be skipped over. Skipping over this part puts the work we do in practice at risk. Disregarding research evidence leaves us at risk of our approaches being outdated or not as impactful as they could be. Our practices may inadvertently be reflecting systemic or practitioner bias. Leaving this bias unchallenged can perpetuate the bias. Leaving out the research and evidence piece also limits the opportunity for impactful innovation because it leaves current practice unchallenged, and there is a temptation to simply recycle practice that is most comfortable for the practitioners. It also means that we will not have good evidence for our impact, which can hinder attempts to secure funding. Good practice requires constant dialogue with research and evidence. Sometimes we might find that there is not an evidence base that demonstrates the effectiveness of an approach that we would like to try. There are 2 reasons why this might be the case. First is simply that there hasn't been any research on this approach yet. That does not mean that we should abandon the approach that we would like to pursue. This actually provides a wonderful opportunity for innovation. You might be sitting on the cutting edge of a practice and a wonderful new initiative. If the approach that you're wanting to implement has been assessed across all of the other wedges of the heptagon approach, and it is an excellent fit, except for that missing evidence piece, you can proceed with your innovation. However, whenever possible, Research evidence relating to similar elements of your initiative should be reviewed to help inform the design of your initiative. And very importantly, you must embed research into your implementation, carefully tracking your outcomes and reviewing progress. If your brand new initiative is proving to be effective, you have made a fantastic contribution to the field in doing this work. If it is not proving to be effective, you need to be willing to abandon your initiative. The second reason there might be no evidence for the effectiveness of an approach you want to try is because there has in fact been a rigorous program of research, and the research has demonstrated that the program or approach is ineffective, or even worse, that it may cause harm. There's a very famous example of a program that was widely implemented despite evidence showing that it was harmful. You may have heard of it. It's called the Scared Straight program. This is a program that is intended to deter young people from committing crimes, and it is implemented across the world still, including in Australia. The main component of this program is an organised visit to a prison for young people who have been engaging in some kind of criminal behaviours. The intention is to frighten them, so they decide for themselves that they do not want to do anything that would land them in jail. The program also includes some confrontational education sessions. Now, obviously, there are many service providers out there who think that this sounds like a great idea, and an opportunity to give kids who are off track a big wake-up call. However, there has been rigorous research and evaluation, and there is no evidence that Scared Straight or similar programs decrease delinquency amongst those young people participating in these programs. In fact, Scared Straight and similar programs were found to increase the rates of juvenile delinquency amongst youth, and so it was actually doing harm. Nonetheless, the program continues to be implemented across the world because some people think it's a terrific idea, either despite the evidence or because they have not taken the time to review the evidence. As this example illustrates, understanding the research evidence is critical to good practice and to good outcomes. Once we've decided on the program or approach we're going to take, the next most important task is to embed ongoing evaluation. It's not enough to know that our approach worked for others. We need to know that it's working for us in our context and whether the impacts of the program are being sustained over time. Doing this work can take significant courage because it means that we are opening ourselves up to the possibility that an approach we have implemented, that we have invested heavily in, is shown not to be as effective as we had hoped. Here is a real-world example of courageous practitioners and service organisations who were willing to put their program under rigorous research scrutiny. Some years ago, I was part of a research team that was working with 3 partner organisations, Karitani, the Benevolent Society, and 54 Reasons. They were all running volunteer home visiting programs, and they were struggling to secure funding because the body of evidence for volunteer home visiting programs was not strong. The 3 partner organisations felt strongly, based on their own experience and anecdotal evidence, that their program was working. They came together with the researchers and built on practice wisdom and experience and the research evidence. We designed an exemplary volunteer home visiting program that's called Volunteer Family Connect. This program was then implemented across all 3 organisations, and we conducted a rigorous clinical trial to examine its effectiveness. This was a massive investment of time and resources. All of the partners knew that if we could not demonstrate effectiveness, the program would need to be discontinued despite the investment and despite their belief that it was of value. To cut a long story short, we were able to demonstrate that this volunteer home visiting program was effective in supporting families who might otherwise fall between the service gaps. Volunteer home visiting has an important place on the landscape of services available to families. And so this program has continued, it is expanding, and we are still in partnership doing research and looking at the meaningfulness of this approach for diverse families in diverse locations. Embedding research in practice does not necessarily mean that you need to conduct a great big trial, as I've described. There are some first steps that you can take. The most important first step is to create a program logic for any initiative that you're delivering. Program logic documents can be very big and complex, but they can also be very simple. For our purposes here, I'm going to talk you through the most simple version of a program logic. At the very least, you need to understand your goals for the initiative. This will reflect your understanding of the needs to be addressed. These goals should then be matched with whatever strategies you're putting in place. You then need to identify what you think the outcomes will be, and you need to match these outcomes with a plan on how to measure the outcomes so that you will know whether you've met your goals. So let's talk through a good example of a simple program logic. What we're wanting to do is increase the reading interest and skills of children in a primary school. So we have two goals. We want to increase interest and we want to increase the reading skills of the children. And so we develop some strategies that align with each of our goals. We create and post around the school some posters featuring each teacher in the school and their favourite book. We have children in a class make the decision about the book that the teacher will read aloud to the class. We organise our Book Week parade and craft activities for Book Week. We establish a children's library committee, and in this committee the children are able to nominate how a percentage of the library budget is spent and the books that are purchased with that money. And then we ask all of our admin staff to ask the children, have you read any good books lately, in as many as possible of their incidental interactions with the children. So those are the strategies we've developed, trying to build interest. So to address the goal around increasing reading skill, we established DEAR time each day, where DEAR is drop everything and read time each day, and we decide to subscribe to the accelerated reader program. Okay, so now we have to make a decision about the outcomes that we will measure, those outcomes that will let us know whether or not our strategies have been successful. So our outcomes include that children borrow more books from the library, that children are more engaged in story time in class, and that children can talk about the books that interest them. And our outcome for Goal 2 is demonstrable improvement in reading and comprehension. And now our task is to line up measures, so to think about how we're going to measure those outcomes. An important measurement tool will be borrowing statistics, including looking at the numbers of requests to the library and multiple borrowing of the books. We're going to gather observational data around child engagement, and we're going to look at the level of child engagement with Book Week activities. So those are our outcome measures around interest. For our second goal around skill level, we're going to be looking at the NAPLAN results as an important outcome measure. We're going to be looking at whether children move up in their reading group levels in class, and we're going to be able to generate reports from the accelerated reader program. So I hope that you can see from that example how nicely each of those columns align, that the strategies build directly on the goals, that the outcomes are clear and related to those goals, and the measures are directly linked to the outcomes we're hoping to see. I've tried to fit a lot of information into 20 minutes, and obviously I can only scratch the surface, but a great resource that I would refer you to on how to embed research and create program logic documents can be found at the Australian Institute of Family Studies website, and I've popped the link in there for you to go and have a look at. So just to finish off, a summary of the key messages that I'd really like for you to take away from this presentation. I hope you take away that an evidence-informed approach is absolutely vital for good practice. Research evidence needs to sit alongside practitioner wisdom and child and family views and priorities in all service decision making. Evidence can guide us to strong and impactful approaches and programs. However, they will need to be reviewed to ensure that they fit with local needs and priorities. And there may need to be some adaptation to ensure that those programs are meaningful in the local context. The heptagon tool is a helpful tool, but there are other tools that are also good and help us to think about the appropriateness of a practice approach in our context. Embedding research in practice to ensure ongoing quality improvement and to measure the impact we are having is also critical to good practice. The development of a simple program logic is a great place to start. I wish you well in your endeavours.
We hope you've enjoyed this video, part of the video series Unpacking the Framework for the National Best Practice Framework for Early Childhood Intervention. The review of best practice in early childhood intervention was commissioned by the Department of Social Services. Led by the University of Melbourne, the project team included PRECI, professionals and researchers in early childhood intervention, Murdoch Children's Research Institute, SNAKE, National Voice for Our Children, Children and Young People with Disability Australia, and ACD, Advocating for Children with Disability. Coordination and production of the video series was led by PRECI.